So let's get a little history on Medicare Part D plans, and then I'll get into the changes and a recap of 2025. In 2006, there were 43 carriers offering Medicare Part D prescription plans, and most had more than one choice available. In 2025, we went down to 7 carriers, and most only had 2 choices. Moving into 2026, we're seeing about the same in most states, and some of them only have 1 choice, or possibly 2. For 2025, we had a newly defined Part D benefit design consisting of 3 phases: the annual deductible, initial coverage, and catastrophic coverage. The sunset of the coverage gap, a lower annual out-of-pocket threshold of $2,000. CMS had the ability to negotiate pricing with drug manufacturers, starting with 10 drugs in 2026. Cap cost of insulin at $35 copay. Medicare Part D plans will cover vaccines that the Advisory Committee on Immunization Practices recommends at $0 copay. And the introduction of the Medicare Prescription Payment Plan, which allows you to spread out the costs of your prescription drug costs over the year rather than paying at the pharmacy, designed for people that have very expensive medications that possibly could hit the threshold of $2,000. In 2026, we're going to see the same benefit structure. The true costs, or the maximum out-of-pocket, will increase to $2,100, as well as the standard Medicare Part D deductible will be increased from $590 to $615, and will be more common on most Part D plans. The negotiated price reductions for the first 10 Medicare Part D drugs will take effect in 2026. There will be additional medications that will follow in 2027. Medicare beneficiaries will face higher drug costs as more plans will shift to coinsurance, which is a percentage of the cost of the medication rather than a fixed amount like a copay. And mostly on higher tiered medications, you're going to see that change. $35 copay on insulins and $0 copay on vaccines, and a continuation of the Medicare prescription payment program. I'm going to show you the 2026 standard benefit model. You have a deductible stage where your prescriptions, you're responsible for paying the full cost up to the deductible. Medicare sets the deductible each year. This year it will be next year will be $615. Some plans will have deductibles, some may not. Most will. So you have to look at your prescriptions and find out which medications you take that may apply to the deductible if the plan does have a deductible. Some may only have deductibles on certain prescriptions. The initial coverage is when you're paying a coinsurance, which is a percentage of the costs for which a beneficiary was responsible for. However, the enhanced plans would have a copay, which means that you have a fixed amount to pay for your medications that are covered under what's called a formulary. Every plan has a list of drugs that they cover. Medicare requires the plans to cover at least 2 prescriptions in every classification of medication. In other words, to blood pressure, to cholesterol. Tier level classifications are where prescriptions with each carrier are placed in these tier levels. Typically, tier 1 and 2 are lower cost generics. 3 and 4 are brand medications. 5 are specialty tier for complex medications for conditions such as cancer. And tier 6 are select care drugs. Some carriers may have a tier 6, which is the most common low-cost generics for people like diabetes or high blood pressure. Catastrophic coverage. This is a stage of Medicare Part D when the maximum out-of-pocket costs that you have for your prescriptions reach $2,100. The $2,100 cap includes the deductible. If you reach $2,100 maximum out-of-pocket, you enter catastrophic coverage. And at that point, for the remainder of the year, you will not pay anything more for any prescriptions that are covered under your plan and covered under Medicare Part D. Any medications that you fill through any other resource, like Cost Plus Drugs, Mark Cuban's website, maybe you purchase your medications out of pocket through there. GoodRx, Amazon Pharmacy, Costco. Any of those prescriptions that you do not fill through the plan and you purchase 100% on your own will not apply to the 2100. The 2100 includes, again, the deductible and any costs that you have paid for your prescriptions that apply through your Medicare Part D plan and that are covered under Medicare Part D. And remember, this is a calendar year program, as you know. So if you do hit that catastrophic coverage, it's for the remainder of the year. The plan resets every January. As you are well aware, we are right in the middle of the annual enrollment period, or should I say, just started. It runs October 15th through December 7th every year, where you can make a change to your prescription plan, which we're going to get into shortly. Some of the plans have plan coverage rules on medications, such as prior authorization, where you have to get approval through the plan before you can fill your prescription. Step therapy, you have to have tried other medications before you can fill the prescription that you need. Quantity limits, maybe you need 2 a day and the plan only allows 1 a day. So you would have to do a quantity limit exception. Or coverage exception. What if you take a plan, you can't change your prescription plan during the year because unless you qualify for some special enrollment, and now you have to take another medication and it's not covered under the plan that you chose. Your provider can always request a utilization management requirement or a coverage exception or formula exception to get that approved for you. You can start the process yourself, but your doctor's office would have to get involved with the clinical department of the prescription plan. The plan coverage rules are not necessarily on every medication, but it's something you should be aware of, and I will show you when we go to Medicare.gov how that may apply to certain medications. So let's take a look at Medicare.gov. I'm going to share my screen and we will review how to go over the plans and possibly make a selection on your Medicare Part D prescription plan. I encourage you all to have a Medicare.gov account. You create an account through Medicare.gov. You have to, as of September 2025, have a valid email address to create an account. Most of you probably already have. You can get a summary of your current coverage in there. Add your drugs and pharmacies. If you do have an account, your prescriptions may already be in there that you've been filling throughout the year. Use your saved drugs, or I call them in your medicine cabinet that you stored them all year. And pharmacies are listed, the pharmacy that you've been using to compare costs. And you can also access the Medicare and You Handbook, which is a very valuable resource that gets updated around this time of the year by Medicare. You are going to be logging into your account to review your plan selections, as well as make sure the prescriptions that are in your medicine cabinet are the correct ones. I'm going to input some prescriptions just in case you have to put in new ones and show you how you do that and how you edit. You would go into your account, look for your prescription plan, go to Health and Drug Plans and find and compare. Find Health and Drug Plans. I'm going to put in a zip code. You won't have to because you, again, will be in your account. You're going to select Medicare Drug Plan Part D. Find plans. This will not appear because I'm going in not under an account. However, some people get extra help with prescriptions, whether it's extra help, which is called low income subsidy, and you apply for that through Social Security. You can go on to SSA.gov, Social Security's website, and get an application if you think you may qualify. All these programs, the Medicare Savings Program, Medicaid, are all income driven. I'm going to choose I don't get any help. I'm going to put in prescriptions because I don't have any. So I'll start with a very inexpensive one like lisinopril. Very important that you make sure you have your prescriptions available if you don't know what you're taking, or if you're not sure if it's the brand or the generic. Make sure if you have a tablet, you're putting in tablet, a capsule, you're putting in capsule. Very important when you're reviewing your plans. It can make a difference when you're looking at the costs. I'm also going to put in another medication called metoprolol. Metoprolol has a tartrate, also a succinate. They're two different. So make sure when you're putting in your prescriptions, you put in the correct one. The other medication I'm going to put in is Eliquis, which is one of the top 10 drugs that has been negotiated for 2026 by the manufacturers and Medicare, excuse me. Eliquis. Okay. I'm also going to put in Repatha. I do want to show you a prescription that possibly would require prior authorization. So as you're putting in your prescriptions, you can see here that they are listed. If you have a prescription in your medicine cabinet that's stored, and let's say you don't take 5 milligrams anymore, you use a higher dose, you can just click Edit Drug and put in the dose that you use or a lower dose. You can also change the quantity. You can remove a medication. So if there's a prescription, as I said, that you're no longer taking, you can remove it. Okay. So when you're done adding your medications and they're all in there, correct dosage, medication, tablet, capsule, and the quantity's correct, you can done adding drugs. Now, your pharmacy will appear here because you're using that pharmacy. However, you can put up to a few pharmacies to review, which I do recommend. So I'll click mail order. I'll click Walgreens, CVS, and Bissell. Then you continue to review the plans. The plans will come up. Now make sure, because you're looking at 2026, that at the top, it says you're viewing 2026. You can look at 2025, but not really. We're trying to get into your 2026 plan. Very important that you make sure it says you're viewing. Here are the plans. So I usually look and see what I'd like to sort them by. Maybe you'd like to sort them by lowest yearly drug deductible, lowest drug and premium cost, or lowest monthly premium. I always do lowest drug and premium cost because I want to get a picture of what my annual cost will be. This is the plan here. I always recommend comparing a few plans. These are the top 3 plans to just see they're giving me my lowest out-of-pocket cost for premium and cost of prescriptions, and click compare. This will show you the plans, the monthly premium, the star ratings. Star ratings are what Medicare rates these plans, and they rate them from 1 to 5 based on certain criteria that I will show you when we look at an individual detail of one plan. Shows you the total monthly premium again here, as well as the drug deductible. So this plan has no deductible. These two do. So remember I said before, some plans will only have the deductible on possibly some medications. So it's important to make sure that you know what prescriptions you take that may apply to the deductible. It also shows you that 4 out of 4 medications are covered. Shows you restrictions may apply. Those restrictions are those coverage rules, prior authorization. Maybe there's a quantity limit. Maybe it requires step therapy. We don't know yet, but we will when we decide on a plan. We're going to look at the details. It also shows you your total drug and premium costs for each pharmacy, so you can get a better idea. Now, when you see in-network, that means you're getting a pharmacy that is contracted with the plan, but maybe not the best pricing. CVS is an in-network, Walgreens, mail orders preferred. However, with this plan, you don't see much difference. So maybe you want to use a local pharmacy. This plan, you don't see much difference either, because again, this is maybe not much difference with the pricing. This plan, you see some slight differences. The prescriptions I may have put in may not have made such a difference in terms of the pricing, but sometimes you can see some very large variations. So we're going to just look at Blue Medicare RX Plus, it's just said. So it says here, the 2,100 and 4 out of 4 drugs. So it looks like this person who takes these prescriptions would reach that 2,100 cap. When you scroll down, you're going to see your drug list that you put in. If you need to change any medications, click on change drugs. You can say, oh, I forgot to put in that prescription. When you're done, it'll take you right back to the plan. If you scroll down, it'll show your pharmacies that you've input. You can change the pharmacy. and then continue to view plans, and you're right back to the plan you're looking at. It'll also show you here how do pharmacy networks affect what I pay. Click on that, you'll see what I just stated. Now, there are out-of-network pharmacies, pharmacies that don't work with Part D plans. You are going to pay the full cost of all your medications if you choose an out-of-network pharmacy. So choosing your pharmacies is very important to make sure the plan you choose, that the pharmacy you want to use does contract with your plan. You can see here your yearly drug costs by pharmacy and the estimated total drug and premium cost annually with each pharmacy, total monthly drug cost. And when you go down, you can actually click on each pharmacy and get a little bit more information for each particular pharmacy. So it shows the retail cost, shows the cost before the deductible. So then it shows you the cost after. And it also shows you here, as you see zero, obviously that would be zero because you would hit the out-of-pocket cost of $2,100, so you would be paying zero for those prescriptions that are covered. You can also, which I recommend always, clicking on View More Drug Coverage. This will show you what tier level all of your medications are. It'll also show you what your costs are with this plan. So here's the coinsurance on the higher tiered medications, 3, 4, which I had said previously that you will see more and more plans going to coinsurance on the higher tiered drugs, which means that you pay a percentage of the cost of the medication. Here are the tier levels. So we have a tier 3, which is a preferred brand with Eliquis. Here's a quantity limit. It only allows 60 in 30 days. Repatha has quantity limits as well and requires prior authorization. So what I said before is that your provider, your doctor's office, would have to get approval through the plan or before you can fill that medication. So if you see that, you know that you do need that. Star ratings. As I stated, star ratings were just released for 2026. So you can expand the ratings. The categories are drug plan customer service, member complaints, member experience, drug safety, and accuracy of drug pricing. And then they take all these categories and give you an overall star rating. There's not really many plans that are 5-star rated. So 4 stars is actually a pretty good rating for a Medicare Part D plan. But that's important because you're trying to find a plan. Maybe those things are important to you. You want to be able to contact the plan and you want to see, well, what is their customer service rating? After you look at the plans and you've chosen all your prescriptions, you may see some medications that are not covered. There are medications that are not covered under Medicare Part D. So there are prescriptions like, for instance, Wegovy I use. It's a non-Medicare covered Part D prescription. However, some people get it approved for cardiovascular, sleep apnea, diabetes. So you may see that not covered, and that would require what's called, again, a coverage exception if you need that medication. There are many plans that you may be able to get that coverage exception. And actually, over the years, since Medicare Part D started, more and more plans are allowing coverage exceptions if the correct information or medical documentation is provided to them why you need that medication. If that prescription's not covered, but becomes covered over the coverage exception, it will apply to the $2,100 cap. Remember, what applies to the $2,100 is your deductible and all the prescriptions that are covered under Medicare Part D and under your Medicare Part D prescription plan. Okay, so we've decided we are going to enroll in this plan. So you would click Enroll, Join Plan, and then your information will be in there. I had previously stated on a couple of my webinars that you would have to select annual enrollment period, but Medicare changed it. You don't have to because technically you're enrolling in 2026 and it will be effective for January 1st. So again, you can just put in your information that's needed, possibly only your phone number, go through the application. I can't obviously and enroll. So you fill out the application. There's 2 different ways you can pay through Medicare.gov when you're filling out the application for your plan. You can either get a bill or Social Security deduction. Social Security deduction does take a couple months to set up sometimes. So just to let you know, and it will state that, and get a bill means you just get a bill. If you'd like to pay having it taken out of your checking account, or maybe you want to use your credit card, you can do that once you're enrolled in the plan and you have your ID card. You can create an account and then you can set it up that way, or you can contact member services of the plan that you chose and ask them to set it up for you. When you finish the application, you will get a confirmation page. I recommend downloading it or print it because that is your confirmation that you did your application. Very important because it's the only confirmation you will receive. You can check your Medicare.gov account to see your future enroll plan that you did enroll in for January 1st, 2026, possibly a few weeks later. You will get an enrollment letter within 10 to 14 days from the insurance company you enrolled in. Now, what happens to the one that you're in this year? How will they get notified? They get notified by Medicare. You can only have one Part D prescription plan. So when you enroll in the new plan and you get your confirmation, Medicare will put you in the new plan for 2026. Contact the old insurance company and you will receive a letter in the mail from that carrier letting you know you will be terminated as of the end of December. So it's very important if you're switching plans to make sure that you receive that letter stating that you've been terminated from the plan. Now, let's say you're not changing plans. Your plan that you have, you're happy with, you're comfortable, covers your prescriptions, you saw the tier levels, you did the exercise of looking at the options. There's nothing you need to do at all. You can stay in the plan as long as it's available, and that's it. It rolls over into 2026. You don't have to notify the carrier. You don't have to notify Medicare. If you do not make a change between October 15th and December 7th, you don't have to do a thing. You may get a new ID card for next year, but that's all you need to do is keep an eye out for the new ID card. Okay, I'm going to go back to my presentation. Okay, so I'm going to go through some tips that I had gone over when you're reviewing the plans. Make sure you have the correct dosage, strength, and supply for each medication. It can make a difference on the pricing. Losartan, 20 milligram tablet, one a day, 90-day supply. And make sure what medications may apply to the deductible if there is a deductible on that plan. Remember, I showed you how to see where the deductible is. Very important if you're not with the deductible, because that is kind of hard to see when you're looking at the Medicare.gov plans. So if you're not sure about the deductible and there is one and you do want to enroll in a plan, you can actually contact the carrier directly. If it's, let's say, United Healthcare, you can contact them. I'm going to go back 1 second because I do want to show you one other thing when you're reviewing, just so you understand, which is important. When you're reviewing the plans, let's say you have a deductible and you're not quite sure and you need to contact the carrier. You can click on the plan website right here and they have the phone numbers for non-members as well as members. Let's say you're enrolled in the plan already and you have a question regarding the prescriptions that apply to the deductible. So it is listed right there for you. Okay. Make sure to include a couple pharmacies so you can see if the pharmacy you selected is in network with your plan. You may even want to choose mail order. However, you do not have to choose mail order. It's an option. You can choose the pharmacy that you prefer to use, but it's important. Remember, I said that there's a network pharmacy, standard, preferred. So just make sure you understand if you're going to use a local pharmacy and maybe a standard pharmacy, how it's going to impact your costs. Please make sure to check if your medication requires prior authorization, step therapy, quantity limits, as that would be listed in the details when you're looking at the plans. Medicare's phone number is listed there for you. They can help you choose a plan if you prefer not to go through Medicare.gov and input your prescriptions, and you just want to call them. You're a little overwhelmed. There's too many medications. Call them. They can help you choose a plan, and they can enroll you on the phone. You can also call member services on your ID card that you currently have if you're going to stay with the plan you have, but you just have some questions on the current prescriptions that you have. I have an MID link, which is a Medicare Insurance Direct link on my website for plans that I can offer, which are extremely limited. But what I decided to do for 2026 is leave all the plans available. So all the Medicare Part D plans will be listed on my website. So you can look at all the plans, you can put your prescriptions in, comparing them through my website. I can't do anything in terms of enrolling you, but if you did enroll through my website, I would get a confirmation that you enrolled through my website. However, when you do the application on my website, it goes directly to the insurance carrier. So you really are enrolling with the insurance company. It's just I can see what plan you took. So you don't have to do that. It's just an option. I just made a decision to keep them all there. So maybe it'll help you a little bit. And again, if you are really struggling, here's my phone number, which you all know, my email address, which you all have. And obviously, there's my website. I'm here to help you and guide you as much as I can within the parameters of what I can do. Feel free to email me or call me if you really have a hard time. But hopefully this presentation helped you and you have some valuable information now and you have the recording so you can go back to it to enroll in the right Medicare Part D plan for yourself. Thank you.